Good afternoon, everyone. This is Nastasia Walsh, Program Manager at the National Association of Counties. I'm just going to give folks one more minute to sign on, and we'll be right back to start up with our Stepping Up Network call. Okay, good afternoon. Thank you everyone for joining today's network call. This is our third of the Stepping Up network calls that we're doing here in 2017. My name is Nastasia Walsh. I am a program manager at the National Association of Counties, and I'm going to be facilitating today's network call. For those of you who this is your first contact with the Stepping Up initiative, the network call is part of the initiative to reduce the number of people with mental illnesses in jails. And Stepping Up is the result of a partnership between the National Association of Counties, the Council of State Governments Justice Center, and the American Psychiatric Association Foundation. And we receive generous support from the U.S. Department of Justice, the Bureau of Justice Assistance, and other private sponsors to do this work. Really quick logistics, you can use the questions box on the dashboard to type in questions at any time about what we're covering. We're going to do a lot of Q&A on this network call, not slide presentations, and so please feel free to input your questions at any time during the webinar, during this network call, and we'll get to them with the speakers when we have a chance. If you're having any technical difficulties, please feel free to use that questions box to let us know that, and we'll try and resolve that issue as well. I want to give a quick update on the National Stepping Up initiative. So this month actually marks 2 years of Stepping Up. So we want to thank all of you for your support of the initiative. I've been with it since the beginning, and really exciting to see the growth that's happening over the past 2 years. We have 365 counties across the country that have passed a Stepping Up resolution to join the initiative. The most recent resolution came from Montgomery County, Pennsylvania, which is right outside of Philadelphia, with about 820,000 people. So we're really excited to welcome the folks from Montgomery County to the initiative, and all of you who have been continuing to submit your resolutions. I'm getting more and more every week, so thank you for that. Stepping Up counties represent more than 127 million county residents now in 43 states across the country. So that's about 40% of the U.S. population that's represented through Stepping Up. So a lot of groundswell and support for this. Please feel free. You can go to stepuptogether.org for a list of all the counties who have joined the initiative. And then if your county hasn't joined the initiative yet, there is a template resolution available on that website. And if you pass the initiative and the resolution, please be sure to send us an email so that we know that you did that, and we can make sure that you're included in the list and you're getting all of the resources that we have available through the initiative. On these monthly network calls, I like to highlight some of the work that the National Stepping Up initiative and other folks have been involved in across the country. This month, actually just last week, the North Carolina and Oregon both held statewide Stepping Up summits for counties in their states. Each of them had about 200 people registered to attend for these full-day summits that were put on there. So a lot of exciting things happening there, and a lot of interesting information about what counties are doing in those states. We also presented at the American Jail Association and the National Council on Behavioral Health over the last couple of months. And we'll be at the American Psychiatric Association conference next week and at the National Sheriff's Association conference in Reno in June. So if any of you folks are attending any of these events, we hope that you'll join us, and always interested to hear about the work happening in counties and states around the country in line with this initiative. I also want to give a plug. You should have today, if you were signed up for the Stepping Up listserv just a couple of hours ago, you should have received an email about a Stepping Up event that's happening 2 weeks from today on May 31st at 3:30 Eastern Time. The Stepping Up partners are going to be hosting a live virtual panel discussion commemorating 2 years of Stepping Up. So on there, we'll have panelists who will discuss the progress that's happening in their county and what they've done since starting the initiative and some of their continuing challenges and barriers they face to reducing the use of jails for people with mental illnesses. The event will be live streamed for a wide audience, so you'll be able to watch that on the Stepping Up website, so stepuptogether.org, and also on NACO's Facebook page, which is facebook.com/NACODC. So more information about the agenda and speakers is forthcoming. Like I said, you got an email about it today, so please put that on your calendars. We'll send out another reminder about it. And you will also be able to, we have the Twitter hashtag, which is hashtag #StepUp4 mental health. And so you can join the conversation and engage with your peers about stepping up that way. So we hope everybody will put that on their calendars to join us, like I said, May 31st. At 3:30 p.m. Eastern Time for that live discussion. And thank you for the question. It will be recorded, and we will post a video of it on the Stepping Up website afterwards if you can't make it at that time. But we'd love to have folks engage live if you can. As you know, this year, Stepping Up has launched sort of a new series of webinars, network calls, focusing in on the 6 questions document. We're also having planning conference workshops and peer exchanges and small group networking opportunities. So really trying to have these webinars and these network calls be the place for you to come to get information about what's happening with the initiative and understanding the latest research and strategies and what's happening in fellow counties, all the innovative policies, programs, and practices to reduce mental illness in jails. These monthly webinars and network calls are open to all people who are interested in learning about these topics, so we hope you continue to join us every month on these different calls. Next month, the next webinar series is going to be on June 29th. And it will cover question 4 of the 6 questions document with a focus on strategies for conducting a comprehensive process analysis and inventory of services for people with mental illnesses in your jail. And then we'll have the follow-up network call like we did this month on July 6th, both of those at 2 p.m. Eastern Time. And you can sign up and register for those using the links at stepuptogether.org/toolkit. We also had the first of the quarterly small network calls for rural, mid-sized, and urban counties in March, and the next calls are going to be held in June. As a reminder, so those calls are only for county officials who are involved in the initiative already, so they've already passed a resolution, and we're using those as sort of a forum for discussion and peer networking. So if you have passed a resolution and you're not aware of these groups or you would like to get involved in one of these groups, please feel free to call or email me and we can get you involved in those. I also wanted to note, and this isn't on the slide, that NACO's annual conference is happening July 21st through the 24th in Franklin County, Ohio, which is Columbus, and we will be holding a full day of Stepping Up workshops, educational workshops at that conference. So anyone who is registered to attend NACO's annual conference is welcome to attend those workshops. And you can find out more at NACO.org and click on the annual conference and you can find out a little bit more about that. So that are all the updates that I have for you today on the National Stepping Up Initiative. Thank you for all of your attention and involvement in all the things that we have going on. I want to introduce the speakers on the line for this call. All of our speakers are welcome to join in on the Q&A, and audience members are welcome and encouraged to direct questions to any of our speakers from this network call, or you can sort of post a general question if you'd like, and folks can sort of respond to that. So please feel free, whichever makes the most sense for your question. From our previous webinar from last week, we have Evan Mills and Laura Alexander, who are with Advantage Behavioral Health in Athens, Clarke County, Georgia. We also have Sarah Warren, who is joining us from the Wake County, North Carolina Sheriff's Office. And this week, last week, you'll recall we had Dr. Richard Cho, who sort of walked through the 4 key measures. This week we have Jesse Tyler, who is the research manager, and Will Engelhardt, who's a senior policy analyst at the Council of State Governments Justice Center, to answer some of your questions that would come to them. So I want to welcome back all of our speakers. Thank you, all of you, for being here again. And just to kick off the discussion, I want to ask each of the speakers one question and get your responses on that. So the question that I'm going to ask is, what has been your biggest challenge with establishing baseline data, and how have you overcome this challenge, or how are you planning to overcome this challenge? And for folks who are in the audience, as these folks are speaking, please feel free to start submitting those questions to help kick off the discussion after each of them is done. So just go ahead and use that questions box if you have any questions as folks are speaking. So why don't we start with Evan and Laura from Athens, Clarke County. What has been your biggest challenge with establishing baseline data, and how are you overcoming this challenge?
Thank you, Nastasia. I would say the biggest initial challenge initially was finding the staff and resources to actually put the time in and analyze the data specifically within the context of mental health and justice involvement. Up until we received a grant award for initial JMHC planning grant, we had been receiving data from our local justice partners that were taken from existing reports they compiled on a regular basis, but we didn't have the ability or the time to compare and analyze that data with an individual's mental illness in mind. HIPAA was always a concern among all of those involved, so we needed to be careful to capture this data and keep, in adherence with the HIPAA requirements, which is why Advantage Behavioral Health Systems took the lead so that we could gather, the public data provided by our justice partners on justice-involved individuals and compare that internally within our existing health records. However, an unforeseen bonus to our agency taking the lead on the data collection and analysis process is that it has given us a ton of data regarding trends in diagnoses, charges, demographics, geography, economic status that we're still going through. Additionally, we're able to look for any trends regarding actual client progress within our own treatment programs within the context of their justice involvement. I guess locally a limitation of this process at a systems level would be that this data only reflects those individuals who have been or currently active Advantage clients. At this time, we're unsure of the extent of missing data. However, I would say we do feel confident as the leading provider of behavioral health within this region that we do have access to a statistically significant majority of the group of focus. So, Laura, do you want to add anything?
I would add that the biggest challenge I personally faced with getting all of this baseline data, since I was the one that did the actual data collection for the most part, was diving in and feeling comfortable saying, yes, we can do this. And I think as a group and as a community, we felt that we recognized the magnitude of this project because it's not small. And if you start down this path, it's going to lead you in all sorts of crazy places, and you want to make sure you can follow it through. And I think we were aware of that. And so having the courage and the support really to say, yes, as a community, we can do this and we should do this, I think that was the biggest challenge. And through the grant process, we got an opportunity to take go on a site visit, and we went to Johnson County, Kansas, which has amazing programs And one of the things our team really took away from that visit was that they've been saying yes for 10 years. And as a result of it, they've built an amazing structure, amazing partnerships. And so if we can bring that attitude to Athens and really convince everybody that instead of finding ways to say, no, we can't do this, no, HIPAA prevents us, no, I'm too busy, no, I don't have money, if we as a community can say, yes, we can do this, then we can.
Yes, absolutely. Thank you, Laura and Evan, for that. I think, yeah, that sort of attitude change, that yes, we can, is definitely makes a big difference. Really quick, maybe Evan or Laura, if you could just really quickly talk about what Advantage is, just for folks who weren't on the call before. We had a question about, you know, if you're a county agency or a contractor, or what exactly you do. So maybe just really, really briefly, the role of Advantage Behavioral Health in the county.
Sure, yeah. Advantage Behavioral Health Systems, we're the state-chartered community mental health agency. We cover the 10-county region in Northeast Georgia. However, we're based within Athens Park County. I'm not sure what other states have systems like this, but basically we contract with the state of Georgia to be that safety net provider for individuals with behavioral health disorder and or developmental disabilities. As a safety net provider, I would say 97% of our target population fall below the federal poverty guidelines. And, you know, we're basically, you know, the last, you know, safe haven for an individual with no resources to go to seek support and resources from.
Great. Thank you very much for clarifying that for folks on the phone. Sarah, do you want to take a stab at answering that question about, you know, what is your biggest challenge with establishing baseline data, and how are you all working on that?
Sure. For us, the biggest problem is access to good data. We, in the jail, we do not have an electronic medical record system. We are still paper-based. And so for our population, that's been really troubling in accessing some of these PHI-related data sets. Additionally, as it pertains to the population around stepping up, is we do not have access to our mental health data. So somewhat similar to Georgia, the county in North Carolina has a mental health managed care organization that handles all of our indigent and underinsured behavioral health systems, and therefore a lot of our jail population. They are unable to provide us that data unless there is assigned consent. And because the transition is relatively new, we have not gone through the process of a consent with that population with our MCO, and so we really lack good behavioral health data and the ability to access even some aggregate level information to help us understand our population. So what we've done and what we talked about in the call last week was our jail records management. So just our regular jail system is electronic, and in that we keep track of the responses for the Brief Jail Mental Health Screen. So that was our first stab at accessing baseline data, because it could help us understand what people looked like as far as their mental health situation when they came into our doors at intake. And it's also going to help us understand some process improvements as far as tracking data, accessing additional information around that person, even though we may not ever get a full mental health diagnostic report on that population. So that's where we've really struggled and where we've tried to overcome that mental health data barrier.
Great, thank you, Sarah. And I know, I think that, the sharing and accessing of data is definitely something that other folks who are probably on the line are challenged with as well. So definitely appreciate that. And then Will and Jesse, so Will, both of them, really work with a lot of counties on the ground and help provide some technical assistance on this. And so I don't know, Will, did you want to try and answer that and see, sort of what you're seeing on the ground when you're working with these different counties and what you're seeing as some of the solutions are to some of these challenges?
Yeah, no problem, Nastasia. And, my biggest takeaway from this work with different counties is pretty similar to what you heard from Evan and Laura and Sarah. Hearing from Athens-Clarke County, it sounds like they were able to get a lot of data and really overcome some of that information challenges, but still missing some data coming from the jail itself in terms of a systematic way of collecting information on people with mental illnesses in the jail. And then from Wake County, actually, having a systematic process in place for collecting that information electronically and getting good data was one of the main challenges. And to summarize that in different versions of what we've heard around the country is oftentimes before you can even start with the data, you have to make sure your processes are in place. That can be a pretty time-consuming process to get that systematic collection underway. And we recommend that starts with, as you heard in Wake County, with screening and assessment using a validated screening tool to identify people with mental illnesses at your jail, and then following up those that screen positive for a mental illness with a clinical assessment, and then recording that information electronically and being able to share that. So just that quick process that I walked through is a number of different steps of having staffing to screen that information, staffing to perform the clinical assessment, electronic capabilities of actually recording that electronically, and then being able to get through some of those HIPAA restrictions or different information sharing restrictions in place before you can even get to the point of seeing how you can analyze those key baseline measures of the number of people with mental illnesses in jail. So very impressive to hear the counties that have gone about trying to work around some of these process issues or develop processes to gather this, but oftentimes the main piece we run into is just a bunch of steps that have to be taken before you can get to that data collection process. So Jesse, I don't know if you have anything to add from someone that's actually more on the research side and analyzing the data yourself, but as a technical assistance provider, that's an area that we often focus on, is just developing the processes.
Yeah, thanks, Will. So I think on the data analysis side, the one thing that I would kind of encourage folks that, aren't tracking this in a computerized way now and are trying to move forward to do that, or, you have been doing it in a computerized way but without any sort of standard operating procedure or data dictionary as to how that stuff gets into the system. I've been in a couple counties where they are doing most of the process right and most of the information is getting into the computer, but then when we get the file, it's not a simple coding. It's like someone writes a big text block, and so that I think would it probably seems faster on the front end, but on the back end it's going to just cause a lot of consternation for your data analyst, especially if you're borrowing someone from IT instead of having like a dedicated criminal justice or public health style person that at least knows what these notes mean when they're looking at them.
Mm-hmm. Yeah, definitely. Thank you both, and thank you all of you for responding to that question. And I hope that folks in the audience are thinking of questions and have questions for these folks. So please feel free to put those into the question box on the webinar, and as the questions roll in, I'll start asking them. But I wanted to start off with a question that we got on the last webinar that we weren't really able to get to for time constraints. And I think it's relevant to I think all of the things that you guys have been talking about a little bit. And I was hoping that maybe we'll start with Sarah to talk about some of the nitty-gritty in terms of your process around accessing data from other sources and talking about access to systems. I know you said you sort of touched on this a little bit when you were talking about some of your challenges, but can you talk a little bit about your processes around accessing data, sharing data, and maybe talk a little bit about how you've worked with the university on that too.
Okay, so I think maybe we're in a unique situation because all of the data we currently have that's electronic is technically public information. So any of our information that's around a booking for an inmate, their charge, their length of stay, and even the brief jail mental health screen, because it's not a diagnostic tool, it's a screening tool, we view that as public information. So we are very willing to share information if it's going to help us understand our population. But we've become very cautious to make sure we're going to get some of that information back. With the university, we've had some longstanding partnerships with NC State University and Dr. Sarah Desmarais in the Department of Psychology, as well as a researcher at RTI as it pertains to mental health in the criminal justice system and in incarceration settings. And through those continued partnerships, we've gotten really creative on how we can access data. So looking at what information is available to us through our electronic jail tracking system, and just kind of on a whim, the concept of using the brief jail mental health screen kind of dawned on us as a way to access information and data on the population. So we were quick to jump on that. We are also doing a project, data sharing project countywide, where we're looking at other data sources such as emergency medical services, our EMS system, our homeless system, trying to access information via our hospitals and some potential other sources to help us understand our vulnerable population a little bit better. And what we've done there is we've started with EMS, since they are under the county, and the county owns that data, and our HMIS system, because we also have very good partners there who have a strong interest in addressing our affordable housing crisis in Wake County, as well as assisting vulnerable populations. And so with all three of these, we've been very careful to enter into business associates agreements to cover us if we do share any PHI, that we're going to be okay legally. And we've had long, drawn-out conversations about what information is required. So we went through an exercise of looking at a data dictionary, outlining the data sets or the pieces of data that could be available for sharing in both projects, what data fields would not be able to be shared because of some protection issues. And so it's been a real lengthy process, but we've started with building good partnerships and relationships to overcome that living in the land of no. So if we can all kind of get on the same page about where we want to go, then we can start working through the hurdles to get us to a yes. So as we look to expand some of these data sets, we're working on those partnerships, having those conversations to understand limitations in the data, look at what are some clear wins in the data, so what's some easily accessible information, and then exploring some creative solutions, taking, being a part of this network and learning from all of you and others on the Stepping Up initiative of how y'all are overcoming barriers related to data, and so what are some lessons learned there?
Great. Thank you so much, Sarah. And we've got a flurry of questions coming in as you were talking, of course. So I want to ask just a couple of really concrete ones and then maybe jump over and let the folks from Athens-Clarke County and Will and Jesse sort of talk a little bit about that as well. One, I just want to, reiterate for folks on the phone, you guys are using the Brief Jail Mental Health Screen,
Yes.
correct?
Yep.
And we know that is one of the possibilities. And for the, we had some folks send in a question about, what screener are you using or what kind of screening tools are out there. Last month, we did a whole webinar and network call specifically on screening and assessment for mental illness. And on the network call, we really talked about some specific tools that are out there as well. So I would strongly encourage folks. I don't want to sort of reiterate, that webinar on this call and talk too much specifically about those tools. Would definitely encourage folks to go back and look at that webinar that we did last month. All of the recordings are available on the Stepping Up website, which is stepuptogether.org. But one thing that I did want to ask you, Sarah, is if you can clarify. So you made a comment about the information on the screening tool can be categorized as public information, and folks had a lot of questions about is that right? So that if the data from the Brief Jail Mental Health Screen, is that public information that you all can use, or what are the HIPAA regulations around that? We got several questions around that comment in particular, if you want to address that.
So yes, let me clarify. So for public information, it's not for, we're not going to release it to the media, but we are able to share that information without any defined restrictions, because it is a screening tool. It's not diagnosing anybody with any kind of mental illness, but it is showing us what symptoms they may be showing when they come into jail. And so the idea there is we wanted to be able to provide that information without limitation to researchers and other data scientists to help us kind of analyze that a little bit. And so that's how we considered it. Now, we don't provide personalized pieces of information with that unless there is a business associate's agreement in place, detailing out, this could be considered private information, should it be lumped in with some other factors. So with NC State, what we did is we sent them over the data and de-identified it before we sent it over to them. With SAS, we did not de-identify it. They were unable to use it for the purposes of the research in the way we had hoped they would be able to use it. But in order to send it over, we had a number of agreements in place to protect that information before we sent it over. Now, if we were to send medical records or diagnostic information in this data set, it would be kind of a different conversation. We'd have a lot more legal hoops to jump through before we sent that. But we lumped those questions in the same category as charge information, right? So some people don't like to kind of publish what an inmate was charged with, but it is technically information that's not protected. I mean, it's not protected by HIPAA, and I believe, and I don't. I believe the Brief Jail Mental Health Screen, because it is a diagnostic tool, is not necessarily protected by HIPAA in the same way medical information is. At least that's how we considered it.
Okay, great. Thank you so much for clarifying that, because we did get a number of questions, and I know that folks are obviously, you know, in the audience, and you all too are obviously very concerned about making sure that, you know, people's information is being protected and that you're in line with HIPAA, but also figuring out ways to share and use data that is HIPAA compliant. So I appreciate you sort of going into a little bit of detail on that. So thank you. Evan and Laura, I didn't know if you all wanted to talk a little bit about some of your logistics too, and we did get a question about what screening tool you're using or folks in the jail are using there, and sort of you know, how you're sharing information, if at all, with between your agency, the behavioral health folks, and the jail or other folks. If you want to talk a little bit about you know, some of the details there.
Yeah, you know, I will say that we're probably a little bit behind our partner in that we had to do a lot of this, you know, basically pen and paper, looking through spreads in order to gather the information, in order to show the need, justify the need for implementing a screen, because none of that was done up until this year. And just now, our jail is I think they just now implemented their screen, and they're using the correctional mental health screen for male and female. But none of that was happening. There was not any uniform assessments going through our local justice system. They kind of did their own. Each agency did their own. Now, as a result of the activities that we've been doing, we are looking at, you know, implementing the LSIR throughout the court system, probation, and the police department even. But you know, right now it's almost like we just took pen and paper, and because of us being the you know, mental health provider, we could go in and look at information on individuals that was public, so that we didn't have to deal with the HIPAA stuff. But we can't share that, you know, identifiable information with anybody. What we could do is aggregate it and share it, you know, in that format, and that's, you know, that's ultimately what we've done in order to kind of justify the case. That being said, we've got several data sharing agreements and business associates agreements in draft form, looking through how we are going to kind of implement a couple of processes, you know, like embedding one of our clinicians within the local jail, or developing a co-responder program with the local police department. And so, but we're kind of waiting on some other processes and a couple of funding initiatives to, you know, be determined before we implement that. So, I mean, I can say with all confidence that, you know, everybody's on board. We're just, you know, kind of looking through determinations in order to figure out whether we will have the resources to be able to implement, you know, the programs and address the costs associated with implementing all those activities. Laura, you want to add anything?
I'll just briefly add that we feel very lucky to have the partners we have in Clark County. The jail, you know, without any complaint, handed over a list of everyone arrested for a 3-month span to me. The PD give us reports every single day of every interaction they've had with someone that could potentially be one of our clients. So at this point, we're swimming in data, and we're seeing so many more uses for it and so many ways that we could be communicating with data that we're not. I mean, I would love to be able to send the jail a report every morning and say, of these people you booked yesterday, this many are our clients, and these are their diagnoses. So I guess to be clear, we would be not communicating with the jail staff, but with their healthcare provider, because they're another HIPAA-covered entity. But so if we could go ahead and say to them, you booked this person, they're one of our clients, this is their diagnosis, these are the drugs they're on, it would help the jail provide a smoother continuity of care for this individual. But again, because the volume we're dealing with in this county is so high, we can't just do that by pen and paper anymore. We can't do it without electronic systems in place, some funding mechanisms. So now that the floodgates are open, we're realizing we need some systems in place to help organize them.
And I'll say, you know, a lot of that has, you know, been, you know, as a result of the data that we've collected, it's opened a lot of eyes, and it's made a lot of people at the local level kind of say, wait a minute, maybe this is more serious a problem than we had initially anticipated. And I didn't mention before, from a data sharing perspective, our justice folks are now looking at, I think it's New World RMS system, data sharing system throughout the justice program. So the courts, probation, not the courts.
I know jail and PD.
Well, jail, PD, and possibly probation are going to be involved with it. And, if we are able to, kind of further develop these partnerships, we as the mental health provider will have access to it too, working through all the, the data sharing and business associates agreements. So it's been kind of a thing where we're starting to just peel the first layer of the onion, so to speak, and see kind of the full extent and actual hard data instead of just, anecdotal. Well, we've got a lot of mental health folks going through our jails. We can actually identify specific hard information and share that with, our local mayor and commission and even local and state funders to show, wait a minute, we've got a really good idea of our population. These are our recommended policies that we, can implement to address those. Give us the support that we need in order to do it. And that's starting to happen. But I'd say we're in the very early stages because now we've got this data. Now we're just, figuring out, okay, this is how we deal with it.
And I would like to clarify too, in Wake County, even though our projects are working on the individual level, the only information that we are sharing is at an aggregate level, like Clark County. And we are, like Clark County, we are in Wake County working towards trying to figure out how we might implement a live data exchange on these individuals. So we're working through that as well as part of these data projects going forward.
Yeah, and I want to give another shout out to Johnson County, Kansas too. When we went out there and listened to those folks, it really hit home the fact that data drove their processes and data drove their ability to figure out how they can say yes. It kind of open eyes, and we're trying to emulate that, replicate that process here locally so that we can show this is why you guys should say yes to figuring out how we can address the the extent of individuals with behavioral health disorders through our justice system. One really exciting thing is with all of this data, we're starting to look at the costs associated with this. Now there's a lot of state data, there's a lot of national data, but locally we're trying to figure out how the local costs, the local taxpayer costs associated with housing an individual within our jail systems with a mental illness, the medication requirements, and we're starting to work out and develop relationships with the area hospitals and the emergency rooms to show the extent of these things so that we can basically make a business argument for implementing these programs so that we can minimize the extent, minimize the prevalence of this population in our justice system.
Hey, Evan and Laura, this is Will. Just wondering if, building on that, if you could give an example of one of the data points from your analysis that has kind of opened your eyes to some areas that you can make improvements possibly in your county based on that analysis.
Yeah, so I think the initial shock of finding out that 38% of the jail inhabitants were our clients, it's deeply profound. But that's such a big beast to try to tackle. I think on a much more kind of nuanced level, once we figured out that so many of the charges were parole and probation violations, that is kind of a smaller problem to start thinking about tackling. And so, we've put together some ideas to try to do some more work with our Department of Community Supervision to see if we can kind of dig further into that and prevent people from violating their parole and their probation. But that was a pretty obvious eye-opener.
And I think, as we were digging through, the nature of the charges at our local level was a little eye-opening to me, anyway, that, the majority, like Laura alluded to, the majority of these violations were, probation and parole violations. But even further on down the list, these were nonviolent crimes that these guys were committing, things like, trespassing and public nuisance and things like that. And, when to the, maybe a larger audience within our community who's not as knowledgeable with individuals with behavioral health, there's a lot of stereotypes and a lot of stigma associated with this population. And us, trying to make a local argument for support for this program, I think this kind of strengthens our argument, saying that these guys aren't violent, but they are clogging up our system. We should do something about that.
And by figuring out that it was parole and probation violations, that answered some of the question about the differences in the length of stay, because we found what everyone finds, that individuals with, that are our clients have a longer length of stay in jail than individuals in jail who are not our clients. And what we figured out is that if you're in jail because of a parole or probation violation, you can't immediately bond out. You're not allowed to. You have to interact with the judge first. So that speaks to a little bit of that discrepancy in length of stay, which helped answer that question a little bit.
Great, thank you. And I don't know, this is sort of one of the questions that came in from folks too, is sort of, what are your outcome indicators? How are you tracking or comparing outcomes between individuals with mental illnesses and individuals without mental illnesses? And sort of what are your benchmarks that you're using for success? And so you touched on this a little bit, and I don't know, Sarah, if you guys have something that you're using too.
We actually want to use this initial project, this analysis, to help us determine what those indicators are. Right now, we are not, we're kind of using the Band-Aid approach. We continue to put money and resources into the jail to help those with mental illness, but from a criminal justice standpoint, we're not holding anybody accountable for those increased resources. And it's because we really, from a county perspective and a criminal justice perspective, don't know the prevalence of mental illness in our jail. And so what we would like to do is use the data we find in this initial project to help us identify what we could do, what we could start tracking as far as outcome measures.
And this is Evan. Just to basically ditto what Sarah said. The data that we captured here is our benchmark. So we are looking at the recidivism rates. We're looking at the frequency of arrest rates. Even looking at the costs associated with the incarcerations and the repeated justice involvement as benchmarks, so that we can look to minimize those as we begin to implement some of the programs and interventions that have been proposed as a result of this the data collection.
Great, thank you both. And I didn't know, Jesse, I know that you work with a lot of folks on the ground looking specifically sort of at that data piece. And so I was wondering if any of the folks that you're working with in some of the other counties, have set different sort of benchmarks or the things that they're tracking and the outcomes that they're tracking specifically.
Oh, wow. It's interesting because, since the counties that I go and work for, they generally have a specific question, when we come in that they're trying to address, which, I mean, obviously, like with any jail system, I think most people are concerned with, how many beds are being used and how do we make sure we don't have to build a new pod or something. So, I mean, a lot of the stuff that that they end up using as benchmarks really come out of the analysis that we do during the life cycle of the project. So, if we've identified, what's already been noted, that there's, a fair amount of people coming back from probation and parole, then, they want to start tracking that, and then maybe also start working with the agency reps in their county or region to kind of address that population. We've also had stuff that's like, this doesn't really sound super interesting, but for one county that we worked in, their population spiked in the summer, which I know most of the guys the folks on the phone probably have that same issue. But what we ended up seeing, that it wasn't exactly only because bookings went up in the summer. It was also because the prison system in that state had 45 days to come and pick up the people from the jail facility. And, at one part of the year, they were picking them up in 20 days. And then, during the summer period, it was taking on average 40 days from sentence. So that ended up eating up a lot of their beds. So, yeah, I don't have really a good stock answer for this. It's just whatever your work ends up showing as being, a red flag, then that's the time that you can start really digging in to that population and information and see, why is this different than we've seen over the last 12 months? Why is this all of a sudden different? And then allow people with, good data, ability to get in and start, looking for patterns or different practices, and then also get people out, on the floor to start doing the qualitative part of that and just say, what is it that could have slowed this process down?
Mm-hmm. Yeah, I'm sure that there's a lot of counties that are facing, different challenges with that and looking at different pieces, and obviously there's some outside forces that are going to be impacting that stuff too. So thank you. I actually, related to this question about outcomes, I think maybe it'd be a good time to do a really quick poll about what are sort of the biggest challenges for people using those 4 key measures that Dr. Cho talked about in that first one. So why don't we launch poll number 2 that asks that question, and maybe folks on the who are in the audience can answer that, and then maybe we'll have a quick little discussion about it afterwards. Great, thank you. Why don't we show the results of this one, just to sort of frame the conversation a little bit about it. So some of the biggest challenges. So it's interesting. We have sort of similar numbers for the first one, number of people with mental illnesses being booked, and then connections to treatment and recidivism, but not, people seem, it's pretty easy to track length of stay for people with mental illnesses, which means that hopefully folks are being able to identify them and delineate between people with mental illnesses and people without mental illnesses. And so, interested in, with folks on the phone, if you had any thoughts around these 4 measures, and, which one is sort of challenging for you.
Yeah, I think we would agree with the majority in the polls. The hardest for us to track would be the percentage of individuals connected with mental health treatment upon exit. One of the things that we found through our system mapping process is that we don't have a good system in place for reentry planning from the jail into the community to reenter the community. And so that was one of the recommendations out of this process, for us to look at pre and post discharge planning within the jail setting. So that's, Laura, do you want to?
Likewise, again, we're limited by only having access to our own data for the most part. So I could look up all of those folks again and report back on how many of them came to see us after they were released from jail. But I don't know how many of them were connected to other services in the community, and I feel like that's a pretty big piece of the pie that we're missing.
And I want to say, for us in Wake County, it's hard to say which one of these is the hardest because we do not have access to any kind of mental health diagnostic information. So from a jail staffing standpoint, we don't know what the prevalence is. We don't know who's coming in with an actual mental illness. We do not connect them to services. That's up to our managed care organization to do that. And so because our MCO is responsible for caring for these folks, it's hard for us to track any of it. But we know that if we can get them access to treatment while they're in our facility, the rate of recidivism goes down. And potentially, if we knew who in our jail had a diagnosable mental illness, we might be able to influence the average length of stay. But a lot of the, what we're experiencing is that a lot of the current model takes this out of our control. So that's, for us, understanding that prevalence was the most important thing for us to start tracking with this initial baseline data.
Hey, Sarah, this is Will, and I was just going to add that that's very consistent with what we've heard with a lot of counties around the country. Just if they can't track that first prevalence rate, it makes it very, very difficult to track the other three measures of average length of stay for that population or connection to care recidivism rates. So for that 24% that can't track the prevalence rate, that's the starting point, and then you would need to work from there to get those other measures. And that's why when I was talking before, thinking about processes in place at the jail to identify that information and screening and assessment, that previous webinar that Nastassia was referencing, oftentimes is a starting point for that. And then using that information from there is what we recommend for counties. So that's something that we've heard nationally. And then that connection to care piece is just, when that question is asked and people can't answer it, it's something that's very frustrating for folks. So I know that's an area that if you can come up with that prevalence number, really thinking about how to connect that, overcoming HIPAA restrictions or otherwise to get that information is just so useful for planning purposes. So both of your feedback is very consistent with what we've heard from others.
Yes, definitely. Thank you. And, I think actually, so one of our viewers had this suggestion. I think this is actually a good space to ask this poll question. Maybe we'll launch the poll and I'll talk while we're at it, so you're not just looking at a screen. But she asked the question, I wonder who is for these efforts, who is looking only at people with serious mental illnesses, at people with any sort of mental illnesses, if they're focusing on something else or something more specific, or if they're focusing their efforts on both. And I think, it sort of brought up a good question around, that prevalence rate, and, we don't know who it is, and so where your focus is on there. So just interested, why don't we show the results of this one? Thank you, everyone, for indulging this. And thank you to the audience member who suggested this question, because I think it's an interesting question and discussion point, too. So it looks like we've got about 41% of folks are focusing just on the folks with the serious mental illnesses. About a third are any mental illness at all, and then we have folks who are looking at both, and very few who are looking at neither. So, I think Sarah and Evan, I think you guys have talked a little bit already about who exactly your target is for these things. But I didn't know if you had any comments or thoughts about why you're looking at these folks. Is it because that's all you can look at, or is it because of an intentional decision? So just interested in folks' thoughts on this, and thank you again for that question from the audience. Or maybe leave the poll up so people can look at it while we're talking.
So one of the things that came out of the summit in North Carolina last week was using, in conjunction to a screening and assessment tool, understanding risk factors and criminogenic risk. And so for us, I think it was Dr. Osher's presentation talked about high criminogenic risk and low criminogenic risk. And what we want to do in Wake County is we want to be able to identify those people who are truly at a high criminogenic risk that really need to kind of go through the criminal justice system. They're committing high-level offenses, they have a high risk of violence, and need some of those criminal justice processes versus those that are committing low-level offenses and have a low criminogenic risk. Those people are better served in our community. So for us, we're looking at both because we want to make sure we are allocating resources appropriately and serving these individuals appropriately.
And I'd like to piggyback on what Sarah just said. I think it's more accurate for us to say that our stepping up efforts are focused on targeting people with high criminogenic risk. That does not necessarily include people with a serious mental illness. There are people out there with serious mental illnesses that have a very low criminogenic risk. And that's part of the implementation for these assessment tools and the mental health screens or these other screening efforts. We're trying to identify the individuals with criminogenic risk, not so much focusing on individuals with serious mental illness. I think we might get into a little bit of trouble if we say that we're focusing on people with mental illness, because that may lead to other folks thinking that people with serious mental illness are more prone to criminal behavior, and we do not want to make that mistake within our county.
Great, thank you. And yes, that is, we obviously want to make sure that we're not promoting the stigma around people with mental illnesses being, more prone to violence or to illegal behavior. So definitely appreciate sort of that nuance and that focus on some of the highest risk folks there too. So thank you that was sort of a last minute poll question that we threw in there. So I appreciate folks indulging us on that. We got another question too about resources and sort of, finding basically the money to set up systems so that you're able to do these sorts of analyses that you both have done, and to set up, programs, or whether it's, electronic databases or whatever you need to set up so that you can track these outcome measures. And so, be interested to hear from Sarah and from Evan and Laura, and also from Will and Jesse about what kind of resources you are leveraging to do the projects that you're doing, and how do you see this as sort of a sustainable way of doing it? And maybe if you don't have the money that you'd like, what are some of your thoughts or ideas, or what you would like to do if you did have more of that money? So maybe we'll start with Evan and Laura.
Sure. So our big kickoff was really when we got funded with the first round of the JMHC, the Justice Mental Health Collaboration Planning Grant. But since then, our partners have really stepped up and shown their commitment to this, and are contributing staff time and sharing resources. And so while our initial funding was the JMHC, I feel like now we're slowly transitioning to trying to find a way to do this in-house.
Yeah, I think one of the I guess I don't know what the word is here, the outcomes, I guess, of the planning grant. I mean, our police department developed and created a mental health crisis unit as sort of their answer to this, to dedicate a single officer that is we've got an agreement with that officer within Advanced Behavioral Health Systems that they communicate with a liaison with our organization on a daily basis in regards to potential shared clients. The court systems and everybody else, they've kind of dedicated, designated staff that, are meeting regularly to discuss what our local planning efforts are and what potential implementation activities we might be able to manifest.
Any thoughts from your end, Sarah, on the resources that you all are leveraging? And I know you have that partnership and have been working with some outside folks as well.
We've been lucky, and we've had some. The county makes an allocation every year for behavioral health to our MCO, and there's been some savings in county funds over the course of a couple of years that go to a reserve for behavioral health related projects. So we've been able to tap into that resource for this particular project. But it is of a high priority to our elected officials and our county manager. So if we get to a point where we need to provide regular funding streams for this effort, I believe there's a high priority attached to it to make sure it's funded during our budget process.
Great. And I didn't know, Jesse or Will, if you guys are seeing something different from folks that you are working with around, how they're sort of funding this, or how they're reallocating resources or tapping into resources that already exist to sort of fund some of their efforts around, looking at this data piece, whether it's setting up a system or, so during projects like these folks are doing. Anything that you're seeing on the ground?
No, I don't think that I've seen, this is Jesse, seen anything that's, particularly worthwhile to highlight. I mean, I know that there's some counties that are, seeing if there's a budget surplus coming towards the end of their fiscal year, trying to grab it really quickly and then, put that into creating a system or creating a position, so they'll be able to burn off the money, instead of having it just go away at the end of this fiscal year. And there's others that are moving money around in their budget, which is not a, fun idea to discuss. It's going to, be groundbreaking for anybody. I guess the most sort of clever out there idea I've seen was one county that had implemented a risk tool for everyone, I don't know, 4 or 5 years ago, and use that to make sort of supervisory decisions for their community sentence folks. And I guess it worked. So they, gained savings from not having to use that jail space. So they're reinvesting, their own savings and going forward with it. I guess that would put everybody way too far behind the deadline for this, but.
Great. Okay, thank you. Well, thank you all so much for answering all these questions, and to the audience members for sharing your questions. I think we had a really good discussion today about sort of establishing data and identifying people and some of the concerns and challenges and the implementation of how you sort of make that happen. So we appreciate everyone being part of this. Before we go, I want to make sure, I was hoping maybe we could do some really quick poll questions. We had about 200 plus people register for this call, so we really appreciate everybody staying engaged on this issue. We know sometimes data isn't necessarily the most fun thing that we work on, but obviously just such an important topic for all of us to talk about and consider. So thank you all for being part of this. So I want to launch these quick polls, and we'll just do them really quickly. Can we launch the first poll? Just to figure out, sort of who's on the phone with us and get some quick feedback from you. Great, thank you. And can we launch the next poll, please? Great. And the next one? Excellent. And the last poll, please. And just, while you're filling out this poll, for those folks who answered unsure on the last one about whether or not your county had passed the Stepping Up resolution, just be sure to go and check out stepuptogether.org/what you can do. So if you just go to the stepuptogether.org website and click on the What You Can Do button, you'll see the list of counties that have passed, and so you'll be able to tell if your county is part of the initiative already, and you can download a resolution there as well. So we'd love to have you join us on that. All right, let's go ahead and close that poll. Thank you, everyone, for doing those poll questions. We do use them and like to know who's joining us on these calls, so we appreciate it. So just to close, I just want to remind everybody, especially for those who signed on late, we do have our next webinar and network call coming up. We're going to be talking about conducting a comprehensive process analysis and inventory of services. So we hope you'll be able to join us for those on June 29th and July 6th at 2 p.m. Eastern, and you can register for those on stepuptogether.org/toolkit. That is also the website where you'll be able to find this webinar, this network calls recordings, and any of the slides and all of the previous ones as well. So please feel free to check it out there. Give us just 2 days to load the recording of this one up there since it's not automatic, but we will have those up there. We also hope that folks will join us for the May 31st 2-year anniversary live discussion that you all should have gotten an email about just earlier today, and we'll send out another reminder on the Stepping Up email list about that May 31st event. So we hope you will join us for that. And here is all of the contact information for the staff who works on the Stepping Up initiative, myself, Shanice Bonilla at the Council of State Governments Justice Center, and Lindsay Fox at the American Psychiatric Association. So thank you to all of you. Thank you to all of our presenters and folks participating in the discussion today. And we hope to see you all on next month's Stepping Up webinar. Have a wonderful day.